Good morning, everyone. We are now exactly 2 months into the state of emergency. And I know many Vermonters are getting very tired of having to protect each other in these times, and at the same time are worried about the unknown. And I also understand this isn't easy. It's creating a lot of stress, frustration, anxiety, and even anger. That's why it's so important to take a step back and remember that sticking together, staying united, is the best way for us to get through this. Vermonters are known for helping their neighbors, and since the start of this pandemic, I've also seen a lot of sacrifice. So many stepping up for the greater good. Things like staying home to save lives, supporting food banks and neighbors in need, birthday parades, sending cards and ice cream to senior living facilities, celebrating graduates with photos and yard signs, volunteering, and so much more. You've been there for each other, and I can't thank you enough for doing so. We know we can't let our guard down while fighting this virus, but we can't ease up on our commitment to civility and unity either. I bring this up because on Monday, I was made aware of a disturbing incident right here in Vermont. I learned of a family in Hartford who had New York license plates on their vehicle, even though they had become Vermonters a few months ago. And as they were pulling out of their driveway, they were, amongst other things, told they were not welcome here, and that the governor did not want them here either. And sadly, this happened in front of their 11-year-old child. I want to be very clear. I have no tolerance for this kind of thing. It's unacceptable. It does not represent my views or who I believe we are as a state. While we still have travel restrictions in place, I've been clear. Those who have homes or family here or who must travel are welcome. When I announced this guidance, I said explicitly, we cannot let this become an us versus them situation. And I want to make sure everyone hears that. We can be both neighborly and compassionate while staying safe. We know many who live elsewhere, but still call Vermont home. And they might have family here. And for much of the year, these folks are part of our communities and are welcome. Our borders are not closed. Our travel guidance is clear. We allow people to return to Vermont, but they must quarantine for 14 days. And it's the same for Vermonters who travel out of state and return home. Making this situation in Hartford even more disturbing was the racial undertone used during this exchange with the individual, who is a person of color. So let me be very clear. This is not acceptable, and it can't be tolerated, and there's no excuse for it. You should know the Vermont State Police are investigating, and I personally called the family to apologize. Here's the bottom line. This virus cannot be used as an excuse for hate, bigotry, or division of any type, for any reason. This virus knows no border, and it doesn't discriminate. We're all in this together, and human decency will get us through this challenging time. Let's remember, our common enemy is the virus, not each other, and we should use every ounce of energy to defeat it. If you take nothing else away from this briefing today, please let it be that. So, it's important we don't let up on our fight to find, contain, and suppress the virus. In fact, easing restrictions means we need to make sure we're all doing our part and using common sense. It also means staying home when you can, and always staying home when you're feeling ill. Keeping 6 feet apart from others, washing your hands a lot, and wearing a mask when you're around others in public. Now, I know some would like to mandate masks for everyone, but I continue to believe we'll have better outcomes if we focus on why wearing a mask when you're around others in public is so important. That's why we'll continue to encourage mask use and help people understand wearing it helps keep others safe if we're sick and don't know it yet. But having said that, I think a mandate has the potential to create controversy and resistance that we might not see if we take an educational approach. Plus, what we're actually seeing is the use of masks continues to increase. And that's a good sign that this approach is working. However, I've consistently said we'll make decisions based on the data. So we'll be watching this over the first phase, and we'll be asking the Vermont Retailers and Grocers Association to survey their members. If we find this approach isn't working, and retailers want this to be mandatory for all, we'll consider it before the next phase. In the meantime, the Vermont Department of Health and Agency of Commerce will be working with businesses to ensure they have the educational materials needed to help more Vermonters understand why this is so important. I also want to mention, as a reminder, on Friday we'll be extending the state of emergency, and we'll have a few additional announcements as well. So with that, I'll now turn it over to Dr. Levine for his update.
Thank you, Governor. I want to continue the theme of masks briefly. As you know, we like to be as evidence-based as possible with every public health decision. With facial coverings, the evidence is late in coming, but it is accumulating. In the laboratory, and recently more and more in actual use, masks do seem to reduce respiratory droplet transmission. Interestingly, but not unexpectedly, compliance must be high for this strategy to work. And again, when we wear a mask, we protect others from our own droplets. And since we don't know if or when we are in a pre-symptomatic stage of COVID-19, this is a habit we all need to adopt. Taking our mask with us when we go out is as important as is taking our car keys and wallets. One point I want to clarify: I did misspeak on Monday when mentioning the few people who should not wear masks. I included people who are pregnant, and that is not correct. Alert listeners pointed this out, and I appreciate it. So let me be clear. Some people, such as children under 2 and people with difficulty breathing, should not wear a facial covering. But we do recommend pregnant people wear a face covering when out in public and around others who are not in their own household. I wasn't able to report my informal survey data on Monday because I had not yet gone to the supermarket over that busy weekend. I have since then been to the supermarket, and I am not making this up, and it was a little later, after 7 o'clock in the evening, but there was 100% compliance in the rather large supermarket I was in on Monday night. I appreciated that. Next, I want to carry this theme of experiments a little further. Worldwide and nationwide, as everyone tries to reopen their economies and gain back some semblance of normalcy in their lives, we see many different approaches being taken. Not all are based strictly on science, because the science doesn't always exist. What does exist, though, is a field called virology, the study of viruses, and our understanding of how viruses are transmitted, especially the ones transmitted by the respiratory route and how they behave. And in Vermont, decisions are based on science and evidence whenever possible, and always with an eye on our data and other experiences. But we should and must try to learn from other societies that had this pandemic before us. Literally from experiments. and there are many. Germany, for example, has opened schools to older children. On the other hand, Scandinavian countries have focused on younger children. Asian nations are more authoritarian at times, like China, and often use smartphones to track people's travel and location. Sweden has tried to achieve herd immunity in their population and let their population become infected. They've opened elementary schools, but now they seem to have a rising and higher case fatality rate. And of course, within our own United States, we have experiences ranging from opening multiple sectors concurrently and encouraging mass gatherings and close contact businesses to far more conservative versions. And all of this literally within the last several weeks, making learning lessons a real-time phenomenon. I'm not here to critique any of these approaches, just to let you all know there's a great deal of variety and a great deal for us all to be humble about and to learn. Natural experiments also teach us a lot, and we should be advised by them. We all know the 6-foot rule, and this has become dogma: physical distancing. But common sense tells us that this could not be the entire strategy, and we needed to pair it with a stay-at-home order to really get us to where we are. And we should have every reason to believe that pairing physical distancing with facial coverings will also work. Just consider the following. Just talking and breathing is sufficient to spread virus. Coughing is even better, perhaps a 20-foot radius. Sneezing is incredibly efficient, and there have been reports of droplets traveling 200 feet at high velocity before falling to the ground. It kind of makes sense that a mask might provide just the barrier that's needed to alter this. When we make a lot of decisions about opening various sectors and what to do with our lives, 3 factors often come into play. Is contact close, and will physical distancing be possible or not? Is contact density high, many, many people together in one place? And is contact duration prolonged? How long are we together in a certain setting? I want to tell you about a famous example from a restaurant in China that's been well documented in the medical literature. One ill person was shown to infect people from 3 tables in a row longitudinally, but no table across from that table. And this had to do with ventilation patterns in the dining room and where the air was flowing. And it also helps that people tend to linger in places like restaurants and in bookstores. They're not just in and out like getting a carton of milk from the convenience store. And obviously, being outdoors, one could sit at those 3 tables and probably not have the same phenomenon that would happen indoors. Those are the kinds of things we always have to think about. And yesterday, a case study was published by the CDC in Morbidity Mortality Weekly Reports from Washington State. It talks about a choir of about 60 people. There was one ill person in that choir. By the end of a 2.5-hour practice, that ill person was able to infect 52 out of 61 people. All colleagues, just by singing and possibly by sharing food. It was thought that the aerosol created in the singing was sufficient to do this. But again, that was a close contact situation, no masks, high contact density, and a prolonged duration of time, possibly paired with what we call being a super emitter. Unclear how much that plays a role or not, but it's played a role in previous coronaviruses. So when we talk about keeping Vermonters safe, we try to factor a lot of this into the decision-making in what you've heard the governor term our phased approach. And if you doubt that crowds or close conditions are significant, you only need to look nationwide at the experience in long-term care facilities, in prisons, and most recently in meatpacking plants. But there are ways to handle all of this. Now let's take a look at data in the U.S. Many states, including Vermont, are seeing a lull in the number of cases, generating enthusiasm for rapid reopening. We all know that it takes 2 to 3 weeks to see an impact of any change, because that's the time interval that elapses between initial infection and eventual people becoming ill, entering in a hospital potentially, or even dying potentially. So the tendency at times may be to drop our guard as cases and deaths are dropping. But this is a dangerous phenomenon because they can quickly and exponentially rise up again. But if a state is well positioned to succeed, it is Vermont. As I've shared previously, we've already met the 4 criteria that you've heard about frequently here and in Washington. Our number of cases and the incidence of new cases has dropped. The positivity rate of our tests has dropped quite significantly. The healthcare system is not threatened by a surge at this point in time, and it has capacity to treat all who come to it. We have capacity to test many, many Vermonters, and we have the capacity to do contact tracing if we find cases that are new. So when you hear us talk about the 2 to 3 week lag time and the importance of increasing testing efforts throughout the state, this should help you understand why. So this is not really the time to relax and suddenly see the data change and then have to return to a state of more behavior change and enforcement of stay-at-home kind of philosophies. This is really a time to capitalize on our ability, which we have now, to contain the virus if it should flare up in any particular part of the state or community. It will require us all to exercise our new opportunities to socially connect while physically distanced, but to also keep up a high testing schedule. And as you know, we have pop-ups appearing literally every other day around the state. I am very optimistic about Vermonters' ability to get through these challenging times. But I think we all know, just watching the news once in the last month, that things will be different for the near term. Most authorities, and I'm in agreement with them, see our immediate future looking a little like the following. Physical distancing and facial covering are here to stay. So the time for our culture change that we've talked about here before is really now. Things like temperature checks and symptom checks when you enter a workplace are here to stay for the near term. Routine testing is here to stay, especially in some sectors like healthcare, long-term care, corrections, other settings that we've obviously prioritized in the past, but also in the general population. And hopefully, we will all find that they are being done in more user-friendly ways, like a simple nasal swab that an individual can do themselves under observation, and hopefully, soon, saliva testing will become live, and that's even simpler. Unfortunately, things like restricted visitation policies to vulnerable populations are here for a while. But they've been very successful across our state in protecting our citizens who are in long-term care facilities, correctional facilities, and others. The summer concert of old won't be the summer concert this year. Doesn't mean there won't be a summer concert, but the large mass gatherings of people packed together watching a concert will not be the reality. It may look very different. Things like entertainment, spectating at sports, and then finally schools will evolve in very new and different ways. They may be later on the list of things to open, but it doesn't mean they're out of the question, and they, like many other things, in a different form, will rise up again. Thank you for listening, and is it time for questions?
All right, we'll start in the room with Calvin.
So a question for Governor Scott and also Commissioner Harrington probably. So we're getting messages from people applying for PUA. There's a message that's saying that payments are going to be delayed. I guess how long, or I guess first off, why are these payments being delayed and for how long? We're hearing from a number of people that through the PUA haven't gone, or they haven't had income for 2 months.
Well, again, this program was just started about 3 weeks ago, I believe. So it's my understanding that we had pushed a number of those people, 8,000 or 9,000, over to the PUA system from last week. There was a bit of a delay last week, and that's been rectified. So I believe everyone in the system will be receiving checks this week, but I'll ask Commissioner Harrington if that's the case.
Yes, Governor, you're correct. So there were two things that happened today that may have led to the confusion. As the governor said, there was that group of just shy of 9,000 people who went into the PUA system. They all received emails last night letting them know that they could go in and file. I would also encourage people, we're hearing reports of a lot of these emails going into spam filters. So just as I have the opportunity, reminding people to check their spam filter or their junk folder to make sure they don't miss the email. The other thing that happened yesterday, without getting too complex, is that we were able to process some payments within the system that did not include the FPUC $600 federal addition because we were paying early weeks before the federal bump was enacted or in place. So we were able to process those payments for people who had a delay in payments. But the only delay right now that people have experienced is stuff that has already been reported, and that is the update that was being done to our system last week and for the first part of this week. That update has been implemented, and we are issuing payments today, tomorrow, and Friday. And the only delay people would see at this point would be the mail system if they selected a paper check and it's traveling through the mail. So my understanding is every other delay has been rectified at this point.
And just a quick follow-up, how many PUA, as of right now, how many PUA claims have gone unresolved, and for how long have those claims gone unresolved?
Did you hear that, Commissioner?
I did. So my understanding is our unresolved PUA claims have a short turnaround time. It's less than, my understanding, less than a week. So we did, obviously, with the number of applications we received overnight and this morning, have a number that came out of that need to be resolved. Typically, these are individuals who maybe misunderstood a question and answered it in a way that inadvertently made them ineligible. And so we typically try to adjudicate or follow up with those individuals to rectify those issues. But again, we're able to do that in a matter of days, to my understanding.
Do we know how many? Do we have a number?
I don't at this, so I'd have to pull that number to see how many and what the furthest back is. But like I said, we're able to resolve these on a rolling basis. There are new ones every day. So my understanding is we don't have any that are older at this point than a week.
We can get you that number, Calvin.
Thank you.
Yeah.
Stuart?
A question for Dr. Levine. As you know, some of our universities are planning to, or a modified reopen this fall. Is there a way, is that wishful thinking in your view, given that we're unlikely to have a vaccine and perhaps not a therapeutic by then? Is there a way for universities and even public schools to reopen this fall safely in your view?
Yeah, that's a great question. So the creativity and resourcefulness and innovative nature of people leave everything on the table, as far as I'm concerned. Truth be known, My deputy commissioner and I are on a weekly phone call with a number of the colleges and universities across the state, a growing number actually, not to tell them what to do, not to tell them what they need to jump through in terms of hoops to get to where they want to get to, but to actually just really discuss all of these important issues in a very informed way. We also find that having them all together on one phone call provides a great opportunity to test out new ideas and really get a lot of important input. Early on, we covered things like how do they deal with PPE and making sure that they all have an adequate supply. How do they deal with testing their students, because they all had a small number of students still on campus in the summertime. And as time went on, now we're talking about what's the fall look like. None of them are talking anything about the summertime. But regarding the fall, they're talking about kind of the same things I talked about today. A different world, but a world that they could possibly fit into. Whether that means a large lecture is no longer in a large lecture hall, but it is more virtual, but that the small seminar course actually now takes the place in the large lecture hall because people can be physically distanced and still have the kinds of conversations those courses are important to cultivate, could work. We've talked about what needs to happen in dormitories. Can you have more than one person living in a room? What about bathrooms? What about all of the sanitization, things of that sort? So none of these things are hammered out. None of these things are in stone at this point in time, but they're all on the table, and they're having very intelligent discussions. Even to the point of, well, what about if the professor is 70 years old and he's still a very dynamic professor, but is a little reticent to be in front of people in their late teens, early 20s in a classroom? How can that still work to the advantage of everybody and create a learning climate? So the short answer is that nothing has been hammered out by any means, but everybody is planning for a future in the fall, and if it can't happen, that's fine, but if it can happen, there'll be so much more ahead.
Does that extend to public schools, K-12?
This has only been college conversations. K-12, I might leave that to Secretary French if he's on the phone.
Sure.
I don't know if he is.
Secretary French?
Yes, good morning. Could you repeat the question, please?
Is there a way to safely open public schools this fall, given the absence of a vaccine and perhaps even a therapeutic?
Yeah, we think so. I mean, at this moment, it's our expectation and the direction of our planning to prepare for in-person instruction in the fall, but certainly addressing the fundamental safety and health conditions of doing so will be a key part of our planning in the coming months.
And again, back to my theme, we'll have a lot to learn from, potentially, by that time, because worldwide experience will show one thing or another. Other states in our country will show one thing or another as well.
If I could follow up, Dr. Levine, is it reasonable for an older person, the 70-year-old person as an example, for example, perhaps who works in a retail store to not want to be in that environment, given is that risky?
If we take the word vulnerable and just say, if you're 70, that means you're vulnerable by definition, then I guess, yes, there is some risk. But again, I think if we are incorporating all of the things we talk about, trying to be as physically distanced as possible, making sure that the customers coming in can't spread their droplets to that 70-year-old as effectively because they have a facial cover, if all of the hygiene has been attended to, I would definitely not want to take a healthy 70-year-old and exclude them from the workforce. But I could also understand if they had a concern, and we need to be sympathetic to that.
On the education front, Governor, of course, it's been gone over several times, but have you heard of any, or Secretary French might be able to tell us, but any actual graduations that can take place? We've heard of such things as drive-by graduations and stuff like that.
Yeah, we've asked them to be creative in their approach, and I'm sure there will be, but I'm not aware of which ones at this point. Secretary French, are you aware of any graduations being planned at this point?
Yes, Governor, I've had conversation with about 10 school districts, I think at this point, independent schools, and certainly one of the patterns that's emerging is sort of the drive-in approach. So, you know, we are working with districts to provide them specific feedback on their plans, but I expect districts to come up with a lot of different creative ways to celebrate this important accomplishment.
And sticking with the drive-ins, how about movies? There's, I think, 3 drive-ins in the state. Is there a possibility that they could begin soon? Or?
I'm not aware of drive-in theaters being precluded from opening at all. We've encouraged drive-in religious services, and I would say that this may be, you know, a revival of the past in many respects. So we're seeing car hops and curbside service and so forth, and we may see more of the drive-in theater approach.
All right, we'll move to the phone lines. Up first is Peter, BPR.
Governor, you said you called the family in Hartford to apologize for what happened. What exactly did you apologize for, and do you worry at all that your messaging up until today has fueled the sentiment that gave rise to that incident?
Well, first of all, I had a very cordial conversation with the family, and we talked for a great period of time. In fact, he and his family have watched many of the press conferences and so forth. From my standpoint, again, what I've tried to do is tamp down this us versus them mentality. And I think if you go back to many of my press conferences, I've stated just so. In fact, in preparation for this, I did bring the actual quote from March 30th. This was back about 6 weeks ago, and this was a travel guidance announcement at that time, and this is exactly what I said. Here's what I want everyone to understand. If you don't need to come to Vermont, please don't. This is about public health and safety, which is our top priority. But having said that, we can't let this become an us versus them view of the world. That's not who we are as Americans, and certainly not as Vermonters, and we shouldn't let anything change that. Our message is this: if you're entering the state, you're directed to isolate in order to protect those already here, as well as the capacity of our healthcare system. This will protect those already here while allowing people who own a home or have a family to be here as well. So that's what I said back 6 weeks ago, and I've consistently made this argument that we cannot let this be about us versus them, whether they're from another state or not, or whether they have other license plates on their vehicles and so forth. Now, last week, I think it was Stuart Ledbetter who had asked me about what my message would be to tourism of those coming to the state. And I was fairly blunt, admittedly, about that. But in context, it wasn't about not ever wanting them here. It was about, and I said that, my message is to stay home if you can and not come to Vermont at this point in time. And I certainly had added, we would normally welcome you with open arms. At this time, we're asking you to keep your distance. And if they do visit, they should be prepared to stay for 2 weeks to meet the quarantine. So I know sometimes the messages get mixed, but I wanted to take the opportunity. I did apologize to the family on behalf of the state of Vermont, but also if there was any misconception about my views, because my name was inferred in some of what the person had verbalized. So I just wanted to be clear with him. That wasn't my statement. It wasn't my views, and I wanted to make sure that he knew that we appreciated him being in Vermont, his family moving to Vermont, And this is by far a much more welcoming state than what was shown that day. So again, I just thought it was important to apologize and make that known.
And you said state police are investigating that incident. Based on what you know, do you believe that a crime was committed?
Well, you know, it certainly should be investigated to make sure that there isn't or wasn't. It certainly sends the wrong message, and we want to make sure that we're taking an approach that would again educate the public and give guidance as to what our expectations are. By far, Vermonters are far much more decent than that. It's not who we are. It's not who we want to be. And I believe the vast majority of Vermonters would not condone such behavior. But we're going to investigate. The victim and the family didn't have a lot of the details, so it may not get to an end. But we're a small state. You never know. Maybe someone, maybe they will see who that is, and we'll be able to pick up on that at that point.
Thank you.
Lisa Loomis, the Valley Reporter.
Thank you. This question is for Dr. Levine. I was speaking to a second homeowner from the Boston area this week, and she said that she had had COVID-19, and she knew that because of antibody testing. She suggested that because of the presence of the antibodies, she would not have to self-quarantine when she next comes to Vermont. Given that there's not a lot of clarity around whether antibodies confer immunity and inability to spread the disease, what is your response?
Thanks for that question. I'm going to give your response. I agree with you, actually. The nice coincidence is today is the day that my serology testing work group is actually meeting again. They promised to reconvene a month after their prior meeting, where what you stated was true. Their sentiment was that the accuracy of the tests were not quite there yet, and that the meaning of a positive result was not well understood yet in terms of, are you forever immune? Could you reinfect somebody, etc. So I would not want to rely on her antibody test as a passport. It's often called an immunity passport because right now we can't use the test on an individual to make a decision like that person is immune, that person can go back to work safely. We can do population surveillance using tests like that, just so we know who has been in contact with the virus to this point in time. And that's very useful information for us to have as a state, as a nation, etc. But to actually make individual decisions of high import, until I hear differently, that would not work yet. And I'll be able to tell you soon the results of the group's deliberations this week.
Great, thank you very much.
Kat, WCAX.
Good morning. We've heard from one person who works for a large company who says she was fired or not coming to work due to childcare conflicts. Another several inquiries from people who aren't sure what their rights are with regard to childcare and having to return to work. Is the state planning to put out specific guidance to companies and address any loopholes that might be in there for companies to, based on their size or something else, fire people because they can't return to work because they're caring for their children while schools and childcare is closed?
Well, again, based on your question, it sounds like there is some question out there, so we should provide some guidance, and you can expect that. We'll take a look at that.
Are you aware of employers who have been letting people go due to childcare conflicts?
I am not, but this is, I know it's been a question, but I'm not familiar with any particular cases at this point in time. And maybe I would ask Commissioner Harrington if he's aware of any that have come or been appealed or anything of that nature.
No, Governor, not specific to child care. Certainly the question has come up both from the employer as well as the employee. We are drafting guidance. and actually the person who was working on it just gave birth to a healthy baby in terms of his wife. Gave birth to a healthy baby, so it got delayed just for a minute, but we hope to be issuing that later this week, if not early next week. Again, just giving people a better sense of what is going on and what their rights are, both as an employer but as well as an individual.
Thank you.
Greg, the county courier.
Hi, Governor. Hi, Dr. Levine. So on Monday, I asked you guys about your map and where you were mapping individual cases, and through my experience, realizing that it was likely being mapped by zip code for their mailing address. Dr. Levine, I think you said that you would get back to me if it turned out that that was the case, but you kind of indicated that you thought that through the contact tracing, the state would find out where they actually live. We've had readers reach out to us and let us know that they've tested positive in one of these towns that is still mapping at 0. I know Mike Donohue's been working really hard to try to get numbers out of you guys as far as how many people are out of state that tested positive, that kind of thing. Not sure where you're at on that. But I'm wondering, are you starting to collect data as far as where people live at the time of their requesting a test, or are you still waiting for contact tracing to try to get that data? Because it doesn't seem like that's working.
I'm going to let Secretary Smith take a opportunity to see if he can clear this up.
Let's start at the top, because where we started was the fact of what we are reporting on a daily basis, just to make sure that everybody's on a level set here on what we're reporting on a daily basis. We are reporting every case that occurs in Vermont on a daily basis. The totals that you see on a daily basis includes everybody out of state, in state, that have tested positive for the Corona-19 virus. Now, we were asked to be more specific at one point, and we tried to accommodate that by going to a town-wide map, and we did that. Now, when you go to a town-wide map, we don't include the non-residents in that town-wide map. Now, you talk about, on Monday you talked about the fact that what about the non-positives out there? We track the positives. And if they are positive, we do contact tracing with those positives. We find out where they live, who they've been in contact with. Nowadays, 14 days prior to that, we go back and look who they've been in contact with and moving forward. So their residents should be in those numbers. If they aren't, we'll correct it. Now, do we get everything perfect? No. No state gets everything perfect. But we looked across all states here, and we're doing things similar to other states in the country. So again, I want to reemphasize this because there's been some confusion. Every positive case in Vermont is included, whether you're from Antarctica and visiting Vermont or not. Every case is in that total that we report every day. And again, we break it out by resident when we get specific about towns and counties, because because they aren't residents of Vermont at that point.
So it's my understanding that there's about a 30% false negative for many of these tests. So knowing that, wouldn't it be easier to just collect the data when the test is requested as to what town they're from, so you know at least, you know, where people are having symptoms that could be COVID-19?
So the 30% is a little high for false negative, but there probably is a test out there that does have a 30% false negative rate. But the majority, we actually don't know because it hasn't been well worked out, but we believe it's in the 5 to 20% range. Having said that, when people have a test ordered by their physician, we generally know their address. And it often will be their mailing address, but we know at least how to get a hold of them so that we can connect with them regarding the result of the test. I think we're up to something in the range of 20,000 tests already, so that's a lot of tests, most of whom are negative, to start collecting a lot of information on. So I think from a practical standpoint, it may not make that much sense. People can always get retested if the course of their symptoms and their illness dictates such, and that indeed can happen. So I'm not worried that we wouldn't be able to connect with somebody because we're missing some piece of information or what have you. The more important thing is the person who tested negative but still feels ill is still connected to the healthcare system. And that's really what the crux of the matter is. Can they obtain the health care they need so that those symptoms can be dealt with if there's something new and concerning that's happened?
I wanted to take advantage of that question just for a moment because we have expanded our testing statewide, and I want to talk about that in terms of what we have planned for pop-ups coming up, and it's quite extensive. Tomorrow we will be in Brattleboro, I believe. Yesterday we were in Bennington, where we conducted 256 tests, and these are tests on people that either have adults or children that are mildly symptomatic, or they can go to other places as well, returning Vermonters, and others as well, as we medical care workers, first responders, child care center workers. We are expanding our testing capability quite aggressively in this state, so at some point the objective is that everybody that wants a test will get a test. And so tomorrow we'll be in Brattleboro. On the 16th we'll be in Hartford and Colchester. On the 18th we'll be in Rutland. On the 19th in Barry. On the 20th we'll be in Middlebury and St. Albans. On the 21st, Newport. On the 22nd, Springfield and Morrisville. And on the 23rd, in St. Johnsbury. Just so everyone knows, last night we did a total of 794 tests. We are moving towards making sure that we do expansive testing here in the state of Vermont, and I think it is something that we would hope will help us in both our response to this virus and the tracing aspect. I call it hunting down the virus. Dr. Levine doesn't like that. I think boxing in the virus is the better way of putting it.
So is it too much for the state to collect individual counts of where people reside? I mean, it just seems to me that if you're taking a scientific approach to figuring out where you may or may not have a virus, having more data that you decide later that you don't need is better than, 2 months from now realizing, maybe we should have collected that.
So Greg, you're asking for collecting the residence, not mailing address of everyone who's tested, not just positives.
Correct.
Is that your
Correct.
concern?
Yeah, it would be one more question on on an existing 5-question, survey when they're signing up for a test.
I'm not sure what that would give us, Greg, but I'm going to let someone else answer that.
And we're gonna have to move to the next question.
I'm just going to add one more layer of confusion to this, because when we start looking at the data, and even those who test positive, I know of many people who I have known for all my life thus far, who have made Vermont their home and have retired and moved elsewhere. They still have their home here in Vermont, but they're now a resident of Florida for tax reasons, Tennessee, North Carolina, Arizona, and so forth. And I guess I would ask where those should be listed, whether those should be listed if they're here, whether they should be listed at their home address, or whether they're listed in what is their new state home. So I think it just gets complicated for a number of different reasons. And I think that what we should be doing is trying to concentrate our energy on fighting the virus and getting through this. And we want to give all the information we possibly can. We want to be transparent about this. But when we start setting up this controversy between out-of-state versus in-state, and what that means, much of what I said initially in my remarks holds true. That we're setting up this division of us versus them, this mentality that we need to isolate and shut our doors to everyone. But we just want to keep people safe. So we're doing the best we can. We'll try and bring more clarity as we move forward. But again, I think we're doing the best we can at this point.
All right, Mike Donahue, the Islander.
Thank you very much. First, I'd like to thank Rebecca Kelly for facilitating the response about the elusive numbers showing the various out-of-staters. I did get those numbers last night that showed when the out-of-staters tested positive in Vermont, COVID-19, and it was interesting that 78 out-of-staters have apparently been assigned counties within Vermont by the health department. So my question today, the Grand Isle County region economy depends heavily on summer tourist traffic, restaurants, stores, campgrounds, other businesses. Really have to do a whale of a business May to October to make most of their money or all of their money so they can pay state and local taxes, pay their employees. Several restaurants in the Champlain Islands have waterfront dining, obviously at 6 foot. Spacing is not a problem when you have a long beach or a patio and spread the tables. Same with the Church Street Marketplace and other sites. Obviously, the 25% capacity rule being used in retail won't work for restaurants, especially with staffing. A restaurant with 40 seats would basically have, 10 people, I guess, and by the time you have a chef, a waitress, and a busboy, a dishwasher maybe, that's going to leave you 5 or 6 seats. So what specific relief you see coming for restaurants across Vermont, and when will that come?
Well, again, I believe that we'll have a phased-in approach, that we'll start out with 25% and move on from there. I think the restaurants themselves will have to make the determination whether they cut back on staff and so forth to make that viable. I know it's difficult. I don't underestimate the financial significance of this and what it will mean to our state as well as to those individuals with their businesses. Don't take this lightly, but we don't take the virus lightly either, and we need to do all we can to have this phase measured response and opening that where we can again reflect on the science and data to be sure that we're not putting ourselves in a position where we're doing more harm than good. But the economy is always on my mind. I know the Grand Isle region needs that in terms of their own needs in their own communities, but we need it as a state as well. It's one of our highest sectors. Tourism is a big component of our economic package and part of our economy and part of our revenue. So it isn't lost on me. We're trying to do it as quickly as we can without putting people at risk. I can't give you a time frame at this point, but it is, again, on our list of those initial starts. You'll hear some on Friday, and then we'll be making announcements every week as to what we see the next week or two out.
As a follow-up, to help with the reopenings, Governor, you've, I believe, created a couple of advisory committees which are meeting behind closed doors. We've been told that the debate over restaurants reopening has been divided, maybe contentious, and sometimes even described as heated. Should Vermonters be able to hear the actual pro and con arguments being advanced at those meetings, since those advisors that you have are talking about the health of all Vermonters? This is a lot different than economic advisors meeting at private. This is the health and welfare of all Vermonters and whether restaurants should open.
Well, again, I would say that you listed the key word there is advisory. Advisory to me. I asked them for their advice. It does get heated. It is not everyone has the same opinions, but I want to hear those opinions, and we work it out. I'm not sure if this was a legislative body. I would say yes, they should be public because that's what the legislature is about. It's the people's house. Again, these are advisors to me. Our cabinet meetings aren't public, and we have all kinds of debates within our cabinet meeting, extended cabinet meetings, where there are different points of view, and I take all that in and try to make the best decision I can on behalf of the administration. So I'm comfortable with what we're doing at this point in time. If this, again, was a public meeting in the legislature, of course it should be open to that transparency. But this is advisory to me. And at the end of the day, I'm the one who has to stand up and either I make the decision and I have to live by that decision as well. And I take that seriously. So I just want them to be open, forthright to me. And give me the facts as they know them.
Do you attend every single one of these meetings, or do they ever meet without you?
They do meet without me, but we get together on a twice weekly basis to give me updates and as to where they are and where they stand.
Okay. Thank you very much. Appreciate it, Governor.
Brittany, Local 22.
Hi, good afternoon. So my question is for Dr. Martha Levine in regards to the pop-up testing for first responders that's been going on this week. Just wondering how that's been going and if you know how many first responders have shown up to be tested. And also, do you think this is something that needs to be expanded? Do you think we're going to have more pop-up testing for first responders throughout the state?
Brittany, this is Mike Smith, Secretary of Human Services. Let me sort of answer that question. As I said earlier, we have been seeing success in our pop-up facilities throughout the state. We've only done 2 of them, but we're going to have a bunch of them coming up in multiple locations. Yesterday, I don't have the breakdown of between healthcare workers, first responders, and child care workers. But yesterday we tested in Bennington 256 people. Already in Brattleboro for tomorrow, we have a reserve list of 242 people that fall into that category. So I would say the answer to your question, are these successful? Yes, and they'll become more and more successful as the word gets out in terms of how you utilize these facilities. I also want to remind people that we will be opening up these facilities to returning Vermonters so that they will have the opportunity to test. As Dr. Levine had talked about on Friday, what that will allow you to do is you'll still be required to quarantine for 14 days, but after day 7, you will be able to get tested, and if you come back negative, then you will be able to break the quarantine sooner rather than later on that. So we're very excited. Our goal in this testing environment is to test anybody that wants a test, and we're hoping that we'll get there very, very soon in our testing capabilities.
So do you think that there's going to have to be more sites, more pop-up sites planned in the future, or is that something you're working on right now?
Yeah, so I mean, for this week and next week, we already have them planned in multiple towns and cities. I would expect you will see this continue. I also expect that you will see it continue in other locations as well, whether it's integrated with the healthcare system and whether it's integrated with other areas where people go, pharmacies, for example, in the future. I just want to caution people too, if you have symptoms, contact your primary care physician, because we want you to get tested. So do that as well. We want all people, no matter how mild the symptoms may be, both in pediatrics and in the adult population, to get tested. This is very important. We want to expand our testing capability and Vermonters getting tested in this state.
Thank you.
Joe, Barton Chronicle.
This, I guess, is a continuation of the theme. Along with the testing, I understand you were planning to do tracking. Is that being done at present? And if so, do you expect that to result in higher levels of positive results coming in the relatively near future?
Yeah, I'll let Dr. Levine answer that, but suffice it to say, I think tracing and testing is going to be essential as we move forward in all of this. So we are trying to enhance both, and we've taken steps to do so. So I'll let Dr. Levine sum it up.
This is actually fundamental public health. So contact tracing isn't beginning from this point on into the future. This is the practice that we've had. We're now calling it enhanced contact tracing, because instead of just going back 48 hours in someone's experience, we're actually going back 14 days in their experience, so that contacts they may have had and settings they may have been in can be ascertained as to where their symptoms might have originated from, to really, again, help with what we call containment of the virus. We really do aspire to continue to open up sectors and to really try to return us to some sense of a normal life, even with the facial coverings and the physical distancing. But when you're trying to do that, you absolutely need to make sure that if virus pops up, you can address it at the earliest possible time, and then it doesn't get out of control, and we don't have to start all over again like we did at the beginning of this pandemic with a policy that was really mitigation. It was stay at home, stay safe from the beginning almost. It took a very short time window to get to that point because the country could not do containment. The country didn't have testing capability. The country didn't have a lot of PPE even at times. And so something like containing the virus could not have occurred the first go-around. There's no reason why that can't occur if there is another go-around. And that is really the goal of making sure that our testing is up to speed and that the contact tracing is as enhanced as possible. The other part of the enhancement is technology. And though it's certainly, if you didn't have technology, you could still do very good, thorough contact tracing. With the current technology that we're going to be implementing and have already started to implement, there's a system where the health department and the person who's been traced can connect with each other constantly. We can feed out information. We can feed out directions, advice. The individual can feed back if they're feeling well or they're not feeling well. What was their temperature that day? And all of this data will become important to us and important to that person because that's what they will base what their next action is going to be. How long do they have to be in quarantine, et cetera? So all of this becomes a lot better and more easily implementable when you have a technology platform to apply, which everyone will be receiving this time around. Okay?
I'm still not entirely clear. With the advanced tracing, do you expect to find more cases? In other words,
oh, sure. Yeah. So, yeah, I mean, obviously, if we've contacted you because you had sufficient contact with a true case, there's already an enhanced likelihood you yourself could become a case. It doesn't mean you will become a case, but you could become a case. So having the most accurate idea of all those contacts will lead us to finding more people who have a high probability of becoming a case, and that might eventually become a positive test. So yes, and as the governor has said for many, many weeks now, everyone in the country expects one of the side effects, if you will, of reopening their society is that we will discover more cases, because people will be connected to each other much more socially than they have been when they're in a stay-at-home situation. They'll be out of the home more and more. So we anticipate new cases, and we feel confident we can contain those new cases, accurately identify the contacts, and make sure that the contacts aren't able to infect another generation of people beyond themselves. So yes, we will find more cases, and we will be very effective at containing the virus.
So you would regard finding those new cases as a sign of success?
In an unusual way, yes, I would have to agree with that. I hope we don't enjoy that success. I hope we find very little, but yes.
Thank you very much.
Tim, Vermont Business Magazine.
Hi, Governor. Lindsay Curley last night released a statement on the reopening of lodging institutions to some extent on May 22nd, and I know you're going to say more about this on Friday, but the cat is kind of out of the bag at this point a little bit. But it wasn't clear to me exactly what lodging institutions would be affected by this. I didn't want to misreport it, of course. Is it everything from traditional hotels and B&Bs to Airbnbs to campgrounds and RV centers?
Without getting too far out ahead of myself, I think you would be more correct with that statement. Where, you know, it's lodging across many sectors, but we'll be having releasing some guidance this afternoon, I believe, but it'll become more clear by Friday.
Okay, and just to also clarify, there's going to be a mandate about quarantine for 14 days, and which suggests there has to be some sort of proof. So there's got to be some, as part of these requirements, a lodger would have to prove that they've been quarantined before they get to Vermont.
Yeah, unfortunately, there's nothing that's perfect about any of these scenarios that we've rolled out because we don't have anybody that really is enforcing this. We are still relying on people to tell the truth and to adhere to the guidelines that we put forth.
All right, great, thank you.
Lindsay, do you have anything to add on that?
Sure, Governor. Yeah, the intention wasn't to get out in front of the announcement for Friday, but certainly we knew that lodging, as you mentioned broadly, would need to cancel anything starting May 15th, at least until the 22nd for Vermonters, and definitely through June 15th for out-of-staters. So we will have a process for folks to be able to certify that they have met the quarantine. So that is not encouraging folks to come to our hotels to do the quarantine. In fact, we don't want that to happen. But as the governor talked about earlier, we have folks that are in our state that are not actually Vermont residents that have been here
whether they're staying with a friend or staying at a second home, that would be able to provide a certification of some sort that they have met the quarantine requirement. But there will be much more to come on Friday.
Thank you.
All right, thank you.
All right, Steve, NEKTV. Steve, it's star six
Hello?
on you. Good. Yep. We hear you.
Stars.
Oh, I think you went the wrong way. You were okay before, Steve. Try.
Hi, can you hear me?
Yes, we can.
My original question was about masks, but regarding the lodging, will you be lodging these people in like, say, older buildings that are mostly a forced hot air system where the whole multiple floors are, connected by a forced hot air system, which would seem to, negate any isolation factors?
Who are you? I'm not sure I understand the question. Who would be lodged?
Well, when you were talking about lodging people from out of state and quarantining them.
No, we were asking them to be quarantined for 14 days before coming to the state. Or if they come to the state, be quarantined.
Okay, regarding masks, I used to work with hazardous materials and wear respirators. And with the masks they have today, some of the more expensive ones have valves on them, which would, the exhaust, it would seem to protect the wearer, but not the people around them. And with other masks, any facial hair seems to negate the efficacy of the mask. I mean, and doesn't this seem to? Are you worried about like mask shaming? Because we're seeing people who are not wearing masks, or haven't, it hasn't resulted in any problems, but there seems to be a thing like mask shaming for people who aren't wearing them.
Well, I would say, first of all, that masking is not perfect, but it does take care of the majority of some of the particles that are emitted. In terms of the vent you're talking about in some of the more sophisticated masks, I'm just not sure how they're made and whether they have any type of filter device there either. I would assume that they do, but I just don't know that. In terms of, go ahead.
They filter. I'm sorry. They filter the incoming air, but the valve allows the exhaust from the person's breath to escape unfiltered.
Yeah. Well, it still probably would capture some of the particles within the mask itself, but again, I think some of the more the KN95s and the other construction masks might be better, and maybe some of the cloth masks would be better than that in some respects, but I'll let the doctor and the experts.
Those for the general public, that kind of
Yeah.
stuff.
So that's not the type of mask we're advocating for usage.
And you're not looking at making mandatory yet, right?
No, that's correct, and I know that there's some disagreement about that, and as I said in my remarks, that we're opening up retail and not making it mandatory for customers, but asking them to consider using a mask. We think that that's a better protection for everyone. But I also believe that guidance and education is a better tool than forcing through this compliance method, because it sets up controversy. So at this point in time, it takes a while. Culture change is difficult. Behavior change is difficult. We've seen a vast majority of people already taking that step towards wearing a mask over the last month. I would say that it's expanded greatly. So My hope is that people will do the right thing when they're going into a retail operation or any operation where there's people there and the general public and coming in contact with others, that they would wear a mask. And that would be our goal, is to see more people do it on their own and wear a mask to protect others.
All right.
And
We have to move on to we have to move on to our next questioner. We still have half the list left.
all right, thank you.
Next is Colin, 7 days.
Hi, I was hoping we could get an update on when we might expect the guidelines for summer camps and childcare to be released. Is that coming this week?
I'll let Secretary Smith answer that.
Colin, the child care guidance should be released later today, and we'll have guidance in terms of what the health department recommends in terms of cleanliness and health issues, as well as the maximum class size in that recommendation. So you should see some of those in terms of day camps and child care centers be released today.
Great, thank you. And is that going to be sent out in a press release or posted somewhere?
I don't know if it's going to be press release, but I'll make sure you get something. How's that?
All right, thank you. And then last thing, just for you, can we get an update on the situation at the Chittenden County Correctional Facility?
Sure. As you know, just let me get my numbers here for a second. Give me 2 seconds. This is what I talk about, and again, I apologize to Dr. Levine when I talk about we're going on the hunt for this virus. We have instituted a policy where we are testing all staff in correctional facilities. We feel, we believe, and it's only a belief, that if anybody in the correctional facility is where the virus is being brought in is perhaps through staff. We're testing that right now by testing all staff in correctional facilities. And of course, if one staff tests positive, then the entire facility will be tested. This happened in Chittenden, our first facility where we started staff testing. The staff was at Chittenden Correctional Facility. The first staff tests at Chittenden were conducted on Monday. 84 were tested. In terms of staff, 1 tested positive, and this staff member who tested positive did have contact with the inmates, so we're conducting a facility-wide test on Thursday, May 14th. That will include 74 inmates and 47 additional staff. We will, just so everyone knows, we're going to continue this program. We're going to be heading up to St. Johnsbury next and testing not only the staff there, but also there are some inmates, 45 of them, that we will, 24 of them at Northeast that are kitchen crew. They will be tested, and then we'll move on to Marble Valley, Northern State, and then Southern State. It's part of our mitigation efforts right now. I will say that we're on the hunt for this virus primarily because we're not seeing any symptoms at all in our correctional facilities that we already don't know about. Either they're in St. Johnsbury or they're in negative pressure rooms in Northwest. But we have decided to expand our testing, and as you know, in the first part of April, we said that if we found one positive in a correctional facility, we would test the entire facility. That sort of policy change has made us one of the leading sort of per capita testing entities in terms of correctional facilities in the United States. On a per capita basis, I think we lead the nation in testing in terms of our correctional our correctional department. So that's the latest on what's going on. If we have any more positive tests up there, what we would do, especially in inmates, obviously if there's another positive test, the person stays home. If it's a staff member, if we have a positive test at Chittenden, we'll do an isolation process. A lot that we learned from St. Johnsbury of how to do this. I do want to say this, because I think this is important. What corrections did in St. Albans is truly amazing. They had a full-fledged outbreaks in their facility up in St. Albans, and they stopped it. They stopped it by moving those inmates that were positive, and by the way, they were asymptomatic. They tested staff and inmates at that facility. If an inmate tested positive, they moved that inmate to St. Johnsbury. They came back and tested again a week or two later to find out where they were through contact tracing. They knew who those inmates were, and thanks to the health department, they knew who those inmates were in terms of contact tracing. They had isolated those inmates. They had 7 more positives. They moved those 7 more positives out to St. Johnsbury. In essence, they stopped what could have been a full-fledged epidemic through that facility, and they need to sort of be recognized for what they did. They've already been recognized nationally for what they did. You know, just bear with me for just 2 seconds, because I am going to launch into something here that I think is important. During this crisis, I'm pretty proud of how the Agency of Human Services has reacted, including what Mark has done, what Dr. Levine has done at the Department of Health, but all along the way. I mean, what we've done for aging and disabled, what we've done seeking food and shelter for those that are homeless, what we've done on health care to maintain health care or child care or mental health systems. We kept Vermonters cared for and protected during this time. And that includes the men and women of the Department of Corrections. You know, oftentimes they get a bad rap. And I've seen that happen over the last few days or few weeks on it. There are some out there, and it's only a few, but there are some out there that wish to portray our correctional system as something, I guess, reminiscent of Cool Hand Luke or something like that, and that could be further from the truth. Vermont has one of the most progressive correctional facilities and departments in the country. And do they get everything right? No. But does anybody get anything right? The answer is no as well. But they get a lot right as they move forward. So I do want to sort of stand up for them and say, you know, good job to Commissioner Baker, his team. They've been planning well on a lot of these things, and kudos to what they've done there. So thank you.
Thank you.
Sean, the Chester Telegraph.
Thank you. I've got a couple of questions from readers. First of all, the incidence of pediatric inflammatory syndrome that have been associated with COVID-19 were being noticed just about the same time as the directive to open daycare and summer camps were issued. And we wondered how this information fit into that decision. The other question is, where does the state stand on the use of cell phone data in contact tracing?
So I can start. The first question really has to do, I should probably take a step back and define what you just labeled, in case some of the audience is unaware of this pediatric inflammatory syndrome. It's predominantly been identified, in this country at least, in New York State. 100 cases. Keep in mind the tens of thousands of cases in New York. So it's a very, very small proportion of the number of cases in New York totally. It's not been reported nationwide to any large degree. It's getting better characterized, but since it's so novel, it's pretty new. It's believed to relate to the body's response to the infection, not necessarily the infection itself. And it is an inflammatory syndrome that can cause just a general inflammation throughout the body. Its most feared outcome is if it involves the arteries in the heart, the coronary arteries, because that can obviously cause some cardiac damage and at times even death. Dr. Fauci, in his testimony to the Congress yesterday, just made the comment that we shouldn't feel so comfortable that kids are immune to this, that they're not going to run into trouble, that we should only worry about the adults because the kids seem to have a free ride. This is an example of a very small, hopefully very, very small proportion of kids who could run into trouble when they encounter this virus. Not a generalized phenomenon by any means across the country, but a small portion of kids that could be really, really significantly harmed with a significant illness related to the virus. We've not identified or had one reported in Vermont at this point in time. And when you look at our data on our website, you'll see that there's a very, very tiny number of positive tests that are even in the very young. This syndrome has been reported in infants and in 18-year-olds and everything in between, but we don't have sufficient number of cases of the virus in that population, never mind of this illness in that part of the population. From my participation in some of the planning that's going into the restart process, this syndrome has not surfaced in any of those discussions. So it's not been really a part that would either help or hinder progress with the child care discussion, with the camp discussion, or any of that. And I hope it never does. You had a second question?
Yeah, the second question was, where does the state stand on the use of cell phone data in contact tracing?
Yeah, so none of the system that we're using that I described is called SARA Alert, and it really is a bidirectional information system that allows a lot of connectivity between health and the public, but it does not track their location or their whereabouts. There are other systems that have made the news in terms of Apple iPhone technology, et cetera, that actually could provide that kind of information. There are countries like South Korea where the population has allowed that to happen, and the government, it's not clandestine, it happens, and it's part of what goes on in their society. I would say that that's not what goes on in our society in Vermont, and at this point in time, that's not really going to be a part of the functionality of any of the ways we connect with Vermonters.
Thank you.
Chris, Newport Daily Express. Chris Roy, Newport Daily Express. All right, we're going to move to Ann Wallace Allen, BT Digger.
Hi, thanks. I have a question and then a follow-up. I'm wondering, Governor, what your position is on hazard pay, which I know is still sitting somewhere in the process in the legislature. Now that it sounds like CARES money is available for hazard pay, have you changed what sounded like opposition to it?
I'm not aware that anything's changed with the CARES money in terms of hazard pay, but I think it has to be COVID related, and there is still some controversy. Again, I will reiterate, my position hasn't changed unless the guidance changed dramatically. But even if it has, we have significant challenges in front of us, financial challenges. We're still in the midst of the emergency. We need to pay for that. We have to pay for our healthcare system, prop that up, make sure that it's viable in the future. There's going to be a vast amount of money needed to do that. We also have to provide for economic relief and recovery and so forth. So there's an expansive list. We'll be promoting, putting out a package in the not too distant future to try and provide for relief and trying to jumpstart our economy and take care of some of the folks that need it as well. So I'm not opposed to the idea. I'm just saying that there's more need than there is resources, and the $1.25 billion isn't going to go near far enough from my perspective, from what I see, just the back of the napkin approach.
Okay, and the follow-up is, for the state employees who are still working remotely, do you know how long they are going to stay remote, and are any more state layoffs or furloughs envisioned?
I will maybe defer to Secretary Young if she's on the phone.
I am on the phone, Governor. I heard the first part of the question about how long state employees would be telecommuting, and the governor's stay home, stay safe orders and addenda have been applied equally to state functions and state government employees. So as the governor opens the spigot and opens up offices to more density, we will be gradually moving employees in. But we expect it's going to look a lot different in the future, and we are actually, meeting and looking forward to different variables of how we will come back to work in the office setting.
Do you think more people will continue to be remote then? When you say it's going to look different, do you think part of that difference will be that more people will continue remote?
I would not be surprised if that is the final outcome. There are many who have appreciated teleworking and have been productive, and it's been, useful to them. And on the other hand, we have to, address the needs of the employer, the needs of the employee, and overriding concern absolutely will be how do we do it safely to prevent the spread and to, to stay safe. So we will be guided by, again, the science and the data and the governor's orders.
The second part of that question, thank you, by the way, was whether any more furloughs or layoffs are envisioned.
I'm sorry, I did not hear that clearly.
The second part of the question is whether furloughs or layoffs are envisioned in coming weeks for state employees.
We don't anticipate any in the coming weeks. Again, we are starting work on the FY21 budget, and it's going to, evolve as the revenues evolve and as the virus takes its course. We will be, again, looking at all the factors. It's also variable right now in terms of what we're going to receive finally from the federal government for relief, what impact it's going to have on operations of state government. So again, it's a fluid situation in state government as it is elsewhere.
Thank you so much.
Wilson Ring, AP.
As always, thank you. I have two questions here. One is, actually, I suppose they're both follow-ups after Ann's question. The first one is about the testing for monitors without symptoms. The press release, the health department's daily press release that came out late yesterday afternoon says it is available. Our offering, the tense is now, it is available. And Mike, in your comments a few minutes ago, that seemed to be a little more forward-looking. And I was just wondering if you could square those two things. Is that something that is being offered now, or is something that you hope to do soon? And then the second question is, again, is following up on that, the state finances question. Governor and anyone who cares to weigh in, how much attention are you, now that the virus news is relatively speaking good, are you turning more of your attention to that problem or the challenge of the state budget? and how it's going to be squared? And those are my two questions. Thank you.
So Wilson, this is Mike Smith. Let me answer your question on the testing and the asymptomatic testing question. Then I'll turn it over to, if it's okay with the governor, turn it over to Secretary Young. I'm no longer the Secretary of Administration, so I won't attempt to answer that. One of the things that we have been pushing is making sure that Vermonters that want to test get a test. Sometimes the health department is a lot more quicker at doing things than I had thought, and so if they put out guidance last night or yesterday that it's asymptomatic or within the pop-up tents, then my heart to them. That's where we're headed. That's what we want to do, and that means that those pop-up tents and pop-up centers are open for people that are asymptomatic.
Okay, so somebody who wants to go to the one in Brattleboro tomorrow can do it.
Yeah, they just can't show up, Wilson.
Okay.
There is
It says they have to make an appointment.
They still have to make an appointment.
Yeah.
So yes.
Okay, that answered that question. Thank you very much.
I'll let Suzanne answer the other. Secretary Young answer the other one.
Thank you, Secretary Smith. Thank you, Wilson. I think your question is, are we turning our attention to the budget challenges for the state, general fund and other budgets? Absolutely, we've been focused on those since the beginning of the pandemic and the emergency order. What is, again, I think as the the legislative economist said, there's three issues here: the fluidity of the situation with the coronavirus, the fluidity of the situation in Washington and funding streams, and then what is human behavior going to be once we get back into restarting the economy. That all impacts our ability to predict or estimate what our revenues are going to look like in FY21. We expect another estimate next week, since the April revenues are now in, a consensus estimate of what we should be budgeting around for the short term in FY21. We are working with our agencies and departments right now to put together what I guess is currently being called a skinny budget, which will be a 3-month budget to get us through the summer into a more formal revenue forecast in August instead of July this year, and then put the final touches on a full year budget depending on the circumstances.
Okay, thank you.
Thank you.
Andrew, Caledonia Record.
Yeah, good afternoon. This is, I guess, perhaps for Commissioner Harrington, if still on call. I understand a group of a couple dozen legislators have formed a kind of customer service team to help act as liaisons between the department and some of the more troublesome unemployment claims that have gotten hung up in the process. Just wondering if you can tell me a little bit about how that has worked out and how it fits into the overall picture of moving some of these claims through the system.
Commissioner Harrington?
Sure. Yes, sir. So it's called the Legislative Action Team. I believe there's roughly 10 or so individuals that are assisting, mainly House members, a couple of senators. They're receiving constituent complaints that are being sent to their colleagues, and they are compiling those, helping to maybe answer some of the most basic information questions, but they essentially aggregate those or compile those into a spreadsheet that we have a team of staff that are working to follow up on those issues. So again, these are constituents that have reached out to their legislator to again get assistance with their claim, and we're working through that list as well to resolve some of those issues that can't be resolved just through information sharing.
And do you have a sense at this point, is there a labor market or a region of the state that is more affected by these troublesome claims than others? I'm thinking, a lot of self-employed and independent contractors and whatnot in the Northeast Kingdom.
I have not seen those numbers yet, so I wouldn't be able to answer that. Obviously, just based on size. The Burlington metro area would certainly have more just due to population, but I haven't seen it broken down by labor market area with regards to the type
as a percentage of population or claim. Okay. All right. Thank you.
Yep. I also just want to add and just throw in a clarifying point. Earlier it was talked about an individual who was terminated by their employer because they needed to stay home for child care. I just, again, want to make sure for the sake of clarity that the right to terminate is a little bit more difficult to explain. There are rights that employees have, both under the Family First Act, but also in our regular state statute. But in terms of those cases where someone is terminated for work and it's due to a COVID-related issue or they need to stay home due to a lack of child care, those individuals would be eligible for unemployment insurance benefits.
All right. Patricia, Bennington Banner.
Hello, can you hear me?
We can.
I'll keep my questions quick here. Is this is really a good question for the governor. Is the 14-day self-quarantine requirement for people coming in from out of state being rethought in connection with summer tourism? And my one follow-up is, I believe you mentioned this earlier, but I just wanted to clarify if you're going to be announcing further loosening of any restrictions on Friday, and if they're social, economic, or other, just what you can tell us about those.
First of all, on Friday, I'll be announcing a few more adjustments, something in the future, just to contemplate, and we'll be making formal some of the lodging issues that opening up with the lodging sector a bit. In terms of promoting tourism, and I'm not sure if I got the whole question, but in the 14-day quarantine, that still exists. We're not trying to promote tourism at this point. Mainly and you'll see on Friday, but this is going to be for Vermont residents only at this point.
So if I understand you correctly, the 14-day self-quarantine requirement for those coming in out of state, that is in effect, and it will continue to be in effect even in relation to tourism.
That's correct.
And I think Friday you mentioned you're going to be making a few more adjustments. My phone cut out for a second when you elaborated a little bit. Did you say anything about what type of adjustments those might be? I think you might have, but I couldn't hear.
No, I did not. I just had stated that we'll be forecasting, giving a sense where we might go next over the next couple of weeks. So I'll be talking about that a bit on Friday.
Okay, and also making some adjustments of some kind.
Yes.
Oh, maybe. Thank you.
Avery, WCAX.
Governor, we are hearing that the state has granted a permit for a 200-person gathering at State Park in July. Is that so? And is there any indication that large gatherings will even be okay over the summer or by that time?
I am not aware of that, Avery. I can certainly talk with the Secretary of Natural Resources and see and get to the bottom of that, but not that I'm aware of at this point.
Governor, Mike Sherling, I can speak to assembly permits in general. All assembly permits that were in place have been canceled, and the ones that have been applied for are all pending and have not been approved pending additional guidance. I'm not familiar with that specific case.
And is there any indication for large gatherings, and not even that large, more like weddings, funerals, things like that?
Well, again, at this point, gatherings of more than 10 are prohibited. Obviously, what we're planning to do is open that up a bit as well in the future to try and go and mitigate as much as possible. So I think you can expect we'll be turning again that spigot on just a little bit at a time. We're in retail, we're starting with 25%. As you might remember, with construction, we started off with 2 and then expanded from there, as well as manufacturing. So I think you'll see the same in some of the more larger gatherings as well. Just everything based on the science and the data, giving us an appropriate amount of time to assess that after we open up one sector to be sure that we're not doing harm.
Thank you, Governor.
Aaron, VT Digger.
We're hearing reports that department heads got a memo about drafting budget for the next fiscal year that included an 8% cut. Can you confirm if that's true? Or if not, the next fiscal year, at least the first 3 months of the next fiscal year. Could you explain if that's true and why 8% specifically?
I certainly will let Secretary Young answer that question, but again, as we see the significant challenges we'll have from a budgetary standpoint in the upcoming fiscal year 21, we are going to have to find ways to do more with less. So, Secretary Young, can you answer the 8% question?
Yes, I can, Governor. As I mentioned in response to a previous question, in consensus with the legislature, we are putting forth a 3-month budget beginning. The budget will begin on July 1st, so we have been working with agencies and departments to determine how much operational money they will need to get through this first quarter of FY21 until the fiscal picture becomes more clear this fall and after our August revenue releases or forecasts. So the direction to agencies and departments was to let us know if they could live with a 23%, meaning 23% of their FY20 budget over the summer. That would be an operationally feasible for them to do. And that does represent, on an annualized basis, an 8% decrease in funding. Now, whether that 8% will continue through the last 3 quarters of FY21, again, remains to be seen based on all of the factors that I've discussed previously.
Thank you.
Yep.
Ed Barber, Newport Daily Express.
No questions, thanks.
Thank you. Guy Page.
Governor, if the legislature passes the bill excluding the governor from the voting by mail decision, are you inclined to veto it?
What I've said from the very beginning, I have my concerns. Hopefully we'll be able to address those with the Secretary of State and plan for the future and do this in a 2-step process instead of a 1-step process. But we're still negotiating on that. If the legislature decides to do another bill and to take me out of the process, I have said that I would not stand in their way. If that's the will of the legislature, obviously they have the numbers. We've seen that they could override any veto, but my concern isn't philosophical on this. It's certainly not political. My standpoint is I think we can do it. We don't know what's going to happen in August. We don't know what's going to happen in July, much less next November. And I would be much more comfortable if I have to be a part of this. I would be much more comforted by having a 2-step process where we make the determination to move forward in August. But that's been, again, from my standpoint, that's been what I believe should happen. I think we should plan for this just in case, but we don't have to move forward until, I don't believe, until after the primary in August.
Thank you.
That's it. Thank you very much for tuning in, and we'll see you on Friday.